You have the opportunity to attend 2 forums presented by the Alzheimer's Association. Haley French is the Community Outreach Director. Good to see you in your purple.
Thank you. Thanks for having me.
What was really the purpose behind these particular forums that you're staging? Well,
what we're doing, we are the Greater Kentucky Southern Indiana chapter, so we're trying to reach different communities and come together with community leaders and families that have been affected, or if you're just curious, to find out what are the needs in your community, not just Henderson or Union County, but we would like for the outlying counties, even folks from Indiana to come across the bridge and join us and let us know what their needs are.
Well, tell us where they will be and when.
Tomorrow evening at Henderson at Methodist Health. It's in the lower level from 5:30 to 7 p.m. We would like for folks to register, just so we're going to provide a light meal, and so we have enough food and enough handouts. And then on Thursday morning, it's from 11 to 12:30 in Union County at Methodist Health there.
Same thing. So how do they register?
They can call our 1-800 number, 1-800-272-3900, and register that way. If they would like to get hold of me and want me to do that for them, I would be happy to do that. Or they can register online as well. And we welcome walk-ins, but we just want to be prepared.
Well, right, you want to feed everybody.
Sure.
What are some of the topics that you hope to cover, and what have you discovered when you've done these kinds of things in the past? What are some of the needs?
Well, we're going to be doing an intro to Alzheimer's, which is an overview of Alzheimer's and related dementias. We're not just the Alzheimer's Association, we're also in all dementias. We're going to be doing an overview of that and talking about the difference between normal aging and having a type of dementia. There is a difference. There's reversible memory loss. And then we're going to briefly go over the warning signs. But most importantly, like as I mentioned, we want to hear from the community. What do you need? Do you need more education classes? Are you needing a support group in your small town? Because, you know, even the outlying small towns sometimes can't drive into Henderson, especially if you're a caregiver. And while we do offer online programs, webinars, some people don't have the internet or don't have a computer.
If you live out in the country, you're not going to have internet coverage anyway.
Right, and we have phone programs too, but we want to find out what the needs are. Maybe it could be they're looking for a physician in the area or in-home care or long-term care, but just to hear from our constituents and for people that are concerned or have been affected by Alzheimer's disease.
Which is every family.
1 in 3 know of someone,
every family.
Absolutely, yeah.
What about as far as our coverage medically? Do we have enough medical coverage for people who are suffering with Alzheimer's and the family and caregivers? Enough doctors that really treat that?
Well, you know, there's a lot of different types of healthcare providers in the field and a lot of very good ones with that. So, you know, you want to begin with your primary care doctor, your internist, and let them know what your concern is. I think there are enough physicians, healthcare out there. We just need to find the ones that are versed in dementia care, and those are questions that we want to ask. But Medicare actually will pay for a screening for those 65 and older, but what they have found in their research is that it's not happening because if the person is not asking the physician for it, the physician is waiting for them to ask, and they're waiting for the physician to ask. So we're encouraging, we want to create awareness and encouraging people, ask your physician to do that, because they're very busy and they're waiting to hear from you.
Well, so. I'm sure the reluctance, I mean, listening to you say that, the reluctance would be, I don't know, do I want to know?
Sure.
And do I want to have this test, and then what do I do? So that's, it's not like coming in there and check my blood sugar.
Right.
Yeah.
Right.
So I'm sure there's that.
Well, the earlier that folks are diagnosed, the more effective the medications are as far as treating the symptoms and even slowing down progression of disease if possible. It does help some people, but so we don't want people to wait. Don't ignore it. It's not going to go away by ignoring it. So, and there's reversible memory loss. What if it's something that can be reversed?
Yeah.
So let's take a look at that and get a complete medical workup and get in to see your physician. But call us. Our services are free. We're here to help families. We have education programs, and if we don't have the resource that you need, we'll help you find it.
Thank you so much for all you do. Don't miss this opportunity to learn all about Alzheimer's dementia from the experts. Thanks again. We'll be back with Tony and Doug. It's Santa Claus Club time. The party's about to get started. These guys are here.